Hello, I'm Emily Holzhausen, Director of Policy and Public Affairs at Carers UK. So I'm going to talk to you today about carers, what they've told us during the outbreak and what we want to see changed, some of the positives and also some of the challenges. So I've entitled this Caring Behind Closed Doors. I'm going to talk about, as I said, carers' experiences, what's positive, what's challenging, and what is next. How can we change the situation that we find us? So carers' experiences have been mixed. The majority of people, all of us, have not experienced anything like the coronavirus outbreak before, and it's quite a huge change to our lives. For some carers, they've felt it's been like a mirror. So in some respects, they've felt that other people have experienced the challenges that they have, the difficulty in getting out, how hard it is to see friends. They've felt that it's like living in a more normal society for them. And that is an issue as we start to face lockdown and things change again. But some have faced real challenges, and some have also found benefits in their life too, and all of those things can happen in one family. It's not exclusive to one or the other. Some of our families share the same things. So I'm going to talk now about some of these things. Now, did you know that because of the coronavirus outbreak, 48% of the public are more aware or much more aware of unpaid carers? It's the highest level of public awareness that we have known. And that was part of our Carers Week research to make caring visible. People felt that they really resonated with that. Of course, we don't want to just make caring visible, we want to see changes as well. And that was the theme that we chose long before this outbreak, and it worked extremely well. The research that we did for Carers Week found that there were a staggering 4.5 million extra carers since the coronavirus outbreak. Even we didn't expect it to be quite that high, and we were very specific. It was about caring for people who were disabled or older or had a chronic illness. And of those 4.5 million, 2.8 million more workers were juggling work and unpaid care since the coronavirus outbreak. So these new carers are younger, they tend more likely to be working, which means that government really needs to look at the shape of its policy as we go forward. So the title of this talk was Caring Behind Closed Doors, and that was the research that we did with carers very quickly in April as we realised that people were facing momentous changes to their lives, so much more than the general public. We wanted to see what challenges people were facing and what were the positives. Well, 70% of people told us that they were providing more care, on average 10 hours a week, but the majority of people here were already caring for over 50 hours a week, round-the-clock care. 22% had said that they had stopped services themselves, even though they could have carried on because they were worried about infection. They were worried about keeping the person they cared for safe, but 35% had seen a reduction in care services. Not all got care services to begin with, so it could have been much higher, but 1 in 3 saw a reduction to their services. So suddenly people were caring much more in an invisible way behind closed doors. The most worrying thing was that 55% of carers said they were worried about burnout in the next few weeks. So these are also some of the quotes that I'll give you a moment to read. You can see that the kinds of support that people rely on, whether it's formal care or whether it's family, fell away during this time, and people were extremely worried, and people still are now. People are saying that they're desperate for a break. So given this situation and how hard it is for carers and their worry about lockdown and safety and how they move forward, we need to see a number of different things change. But first of all, we need to see carers' allowance increased. This is always on our agenda, but right now we want an increased extra payment to recognise the costs, the extra costs that carers are facing during the coronavirus outbreak. This is incredibly important. Of course, we want to see the overall level of carers allowance increased as well as we go forward. ID for carers locally has been incredibly important when we had very difficult lockdown situations and people were travelling to provide essential care. They felt they needed it to prove to the police that they were doing something that was allowed by government. And then on the other side, of course, ID has been incredibly useful with supermarkets and with local convenience stores where carers might have needed adjustments. So that's where things like carer passports come in really handy. Carers desperately want services back, and they want services to be better funded. This is how carers get breaks. This is how people are able to juggle work and care. This is how the people they care for have their own time, learn new skills, have rehabilitation, or indeed they are able to enjoy something. It's so important, not just for carers, but their families too. Carers still need easier shopping and food, and that's something that we've really seen since the early days, that a simple enough task like shopping can be incredibly difficult when your 40-minute shop might suddenly stretch to 3 hours and you can't leave the person caring for at home. And of course, people looking after shielding people have had trouble accessing food. One piece of research we looked at found that carers were twice as likely to use food banks as non-carers. Good guidance from the start. Now, government came out with guidance for carers in England not too long after other guidance, but what we've seen is it's essential that that immediate message that goes out to people and ongoing messages, we have to understand how they impact on carers. So government being clear and working with Carers UK and others to make sure that we translate that into what works for carers and what carers are allowed to do as well within that. So good information and advice has been essential all the way along, and we've been guided by you in doing that. Testing and PPE has been a thread throughout. We're very pleased to see that carers were finally included to the list of key workers who were able to be tested, but PPE is still an outstanding issue in England. In Scotland, they have found a way to get PPE to the carers who really need it, who most need it, and some local authorities have small amounts available for those who are most vulnerable. But that's something we have to come back to establish those routes in the future should anything more happen. We need the NHS to value carers more. It's been extremely difficult during this time when people have not been able to visit their relatives in hospital. When they have learning disability or autism or dementia, it's been extremely stressful. And care homes too. We've seen the distance that that families have to make extremely challenging for them and for the residents as well. And finally, we need better rights at work. We need a right to time off at work, at least a week's leave, and we need support at work as we go through these changes. We want to ensure that carers are still able to be furloughed until they're able to go back to ensure the safety of their family. So 75% of the public think the government should increase support for carers. And these are the three things that we want to see in a nutshell. We want carers to be visible, we want carers to be valued, and we want carers to be supported. So carers experienced a lot of challenges during this time, but there are also some positive experiences that they themselves say they've experienced, and some of these can go alongside the challenges as well. Some carers have said that life is a lot calmer, not having to make complicated decisions about how to get out of the house, that life is simpler. And that's something I'm sure they will wish to hang on to as they go forward. But how can we make that possible with carers still being able to access the things that other people are able to? Family and neighbours have called carers, they've been more in touch, they have helped in situations where they might not have done before, and that is positive, and carers want to keep that. Recognition, as we said, 48% of the public are either more aware or much more aware of carers. Carers definitely do feel more recognised. People have made new connections with new groups, with new people locally. They've found new ways of doing things. And some have said that me time has been possible. For example, when the government said take 1 hour, you're allowed 1 hour of exercise. They actually use that to focus very much more on doing a small bit of exercise, sometimes up to an hour, on themselves, which they said was extremely beneficial. That at other times life can be too full, too difficult to get that physical activity and me time in. Other positive experiences, things like digital. Carers have learned new skills. I think we've all learned new skills, actually. We're all using digital slightly differently. Of course, there are some people who haven't got onto digital, but lots of programs to make this possible, opening up different experiences for people. New services have been created. Some local authorities have helped carers to get online. Others have created Zoom calls, and Online Carers UK has its Care for a Cuppa, for example, online chat every week with carers. And we've seen a proliferation, a huge expansion of new services that are remote. And some carers say that this is better. A lot of local organisations have kept in touch. Our volunteers, Carers UK's volunteers, have been regularly phoning some of our members who are harder to reach. So we would like to keep some of those services. Carers have learnt new skills. Sometimes they've had time to look at learning something new, and others have learnt new digital skills, and people have been thinking differently. How can I get my shopping? Can I go online and get that? And some of those things are here to stay. So what would you like to stay? What would you like to keep? And what do you really want people to think about going forward? What we're doing next, we are Carers UK is campaigning. We are a membership organisation of carers, run by carers, and the majority of our board of trustees are carers, and we will continue to campaign to get a better deal for carers, and we will advocate for carers and with carers. We will ensure that your voices are heard at all levels. We provide a lot of information and advice, and we will continue to do that and continue to tailor it. We've updated our information and advice as soon as we've heard new announcements. And of course, we'll be working with others, whether those are statutory organisations, other organisations in the voluntary sector, to make life better for carers. So I'm just going to leave you with two campaigns that I'd really like you to look at and get involved in. The first is our Fairer for Carers campaign, and that's to get a rise in the level of carers allowance. You can look at that on our website. We will be doing more activity with carers throughout July and August. And then the second thing is the government has proposed a week's unpaid carers leave for carers who are juggling work and care. The consultation deadline for that is 3rd of August. We really want you to join in. It's really important. You tell the government about your experiences. We think this will make a huge difference. We want it paid, of course. We would prefer to see it paid. We prefer to see it longer, but just getting this right established in the workplace would be an enormous step forward. So if you could join us in responding to the consultation, we would be extremely grateful. So I'll leave it there. I'll let you look at those campaigns in the meantime, and I hope that you will continue to work with us to make a better deal for carers. Thank you.